Hi, Joe Ruzick, physical therapist here. Wanted to give you a quick tip on neck and back pain, how you can help yourself on your own right now from home. Okay, this is the most basic thing we do in therapy is we say that first and foremost, the position of your spine is super important, okay? The posture, we call it, right? Reason is if your vertebrae, that each bone that makes up the section of your spine are not in the right position, say they're completely out of place like this from slouching forward, sound familiar? You're going to create constant stress on the muscles, the nerves, and the ligaments. So we have to restore that postural balance, okay? And it's as simple as just thinking everything in a line. So the easiest way to do that is you'll stand up, and I'll step back so you can see me here. What we usually see, the worst postural faults we see are typically forward head, forward shoulder, and kind of a rounded back. I'm kind of trying to overemphasize that for illustration purposes, okay? But a lot of us have this to some degree. So what we have to do is say that is obviously not a good position. We have to think of everything in a straight line, almost like if there was a plumb line hanging down. So how we do that, first of all, you got to start at the hips in the back. That's the foundation. Even if you only have neck pain, you have to start here. What you're going to do is think of kind of flattening or neutralizing that low back, just kind of keeping it in a line. It's going to be straight under your body. Think of it as stacking those vertebrae on top of each other instead of having them off on an angle to each other. So it's kind of tucking the pelvis in. I tell my patients bringing the ribs to the hips. Think of belt line comes to ribs, okay? That's gonna flatten you out there and stack those vertebrae. Step two is get your head and your shoulder back. So ideally, your ear, the tip of your shoulder is in line with your hips. Again, think of a plumb line hanging down. I'd be completely straight going all the way down. That's a simple and easiest way to say, do I have the optimal posture for me? Now, that posture may not be 100% straight, okay? Just from simply trying that quickly. It can take time to do this, but I would suggest try this, try to hold it for up to 30 seconds or a minute, and make that your set point, at least so you know what your set point is, you know what your optimal posture is. Now you may still have to relax out of that a little bit to function and walk and do things, but at least use it as an exercise to say, okay, I'm learning how to hold optimal posture for 30 or 60 seconds 3 times a day. And try to stay as close to that posture as you can when you're doing things throughout the day. Okay? So that's your basic optimal standing posture. I hope that helps. Reach out if you have any questions, concerns, or comments.